Hello, this is a virtual pathology specimen of a loop of small bowel with strangulation of the bowel. What is very strikingly abnormal is the fact that the color of the bowel is very darkish. In fact, it is blackish. In the fresher specimen, it would appear dark red, and this is due to marked venous congestion as well as hemorrhage. The bowel wall itself will be swollen and thickened on sectioning, and we can't see this in this particular specimen because we're not able to see the cross section. We can also observe one other feature, which is in the mesenteric vessels, and as I magnify this area, we can see that on the cross section there are these darkish blackish areas in the mesentery, and this is evidence of markedly dilated congested vessels in the mesentery. Usually the obstruction is not only of the bowel wall but also of the mesenteric vessels. Let's take a look at some possible causes. Strangulation can occur both in the small and large intestine, and strangulation is often due to extrinsic obstruction of the bowel together with accompanying vascular compromise. In the small intestine, commonest causes would include adhesions, for example, due to scarring from previous surgery, hernias, as well as volvulus, and this is when a bowel loop twists upon itself. So strangulation is most often seen in closed loop obstruction, where there is an obstruction between two different points of the small bowel. So there's a segment of the bowel that gets obstructed, and in this instance, the mesenteric vessels will also be congested. Clinically, the patients will experience colicky abdominal pain, nausea, vomiting, and also abdominal distension. And microscopically, there is usually marked swelling of the bowel wall. This is due to edema as well as congestion. Here we can see the veins that are all filled with blood and dilated. There is also a lot of blood outside of the vessels. In other words, there is hemorrhage. And here in this instance, the mucosa is still viable. However, over a prolonged period of time, there can also be ischemia and necrosis of the bowel wall, usually starting from the mucosa. So in other words, there can be hemorrhagic infarction if this is not treated. And this is a potentially life-threatening condition where there can be bowel perforation. There is also a separate video highlighting the virtual microscopy slide of a case of intestinal strangulation. Hence, in summary, this is a case of strangulation of the small bowel, where you can see this blackish, dusky discoloration of the bowel wall, as well as markedly congested vessels in the mesentery. Microscopically, there is marked hemorrhage and congestion as well as edema, and eventually this can give rise to hemorrhagic necrosis, perforation, and peritonitis. Thank you.